Okay, guys, we're going to start soon. We're just waiting for everyone to join the session, and then we'll start straight away. Thank you, guys. Okay, guys, if you are here right now and join us from Zoom, if you want to really ask questions or you want to comment in this case, I would suggest to join from Facebook. Please, admin, if possible, send the link for Facebook here as well so everyone can join from Facebook as well. Hi, Dr. Alifiya, how are you going?
Good evening, Dr. Adam. I'm good, thank you. How are you?
Good, thanks, Dr. Alifiya. How was your day? Good day?
Yes, all good, thank you.
Okay, that's great then. Please, guys, if you can hear us on the Facebook, please let us know. We're just waiting for you. Today, by the way, we're going to discuss about amalgam. And you know what? We're really amazed to do this session since long time. Alifia, when was the last time we did this technical support sessions?
It's been a while, Dr. Adam. I don't quite remember.
But a long time ago, right?
Mm.
You remember we used to do it from the academy itself, from Sydney Academy, the old one?
Yes, that's right.
That was really great time at that time, right?
Yeah, that's true.
Always great time. Hmm?
That's true, that's true. We used to do a lot of sessions from the academy as well.
Did you miss that time?
Yes,
Yeah, it was good time, right?
yeah, definitely. Helping our students is always really good, and we feel really good when we help our candidates and see them as our colleagues soon. So that's always been our goal, and very excited to do another session for them today.
Yeah, same here. I agree on this. Okay, guys, please, guys, again, if you can hear us on Facebook, please, guys, let us know. So we can start. Once you guys let us know that we are clear on the Facebook, so we're going to start straight away. Do you know, guys, which topic we're going to discuss today? If you just joined right now, I'm not quite sure if you really know which topic we're going to discuss today. No one knows? Seems like they don't know, Dr. Alifia.
Hmm.
Do you think they really know?
We'll wait for them to comment so that we know.
Dr. Mubarak saying hi, doctor. Same with Dr. Noel, Dr. Palvisha, Dr. Haya, Dr. Nima, Dr. Siam. Okay. Well, Dr. You're not able to see Dr. Alifia. I don't think really you are able to see the Facebook page, a Facebook group, right?
Oh no, Dr. Adam, I can't.
Okay, that's okay then. So we can see Dr. Sajrati saying amalgam and Dr. Fishali saying hello, Dr. Bidu. Hi guys. Now that's true. Today, guys, we're going to discuss about amalgam. And do you know amalgam is the most common task people fail in it? Am I right about this, Dr. Alifia?
Yes, Dr. Adam, we've seen that in these last so many years since um, that, yes, definitely. Um, Amalgam is a very tricky task, and I still see a lot of confusion among students, even whose exams, like, are soon, or those who have given exams already before. They're still confused. Like when they come to the academy, they don't really know how to target or how to do amalgam, because truly amalgam is not a thing which we do in day to day practice, right? So nobody has that idea about how to go ahead with amalgam, and that's the issue. So yes, it is a very tricky task, and a bit of confusion, which we've always seen, and that's why it's great that we can help our students go through this.
Yeah,
This is
definitely I
something.
agree.
This is one
Yeah,
of our students' work, isn't it, Dr. Adam?
yeah, it is. They are, they are. I will not mention. Actually, you can see Dr. Green and she passed, by the way.
Yeah,
That was in
excellent.
2022, 2020.
Really good job.
Yes, definitely Dr. Green, job was very good. And she passed, even Dr. Sarah passed as well, I believe. Dr.
Really.
Nick definitely passed as well. Yep. Yeah, even Dr. Canel, I think she passed too. You see, the candidates they really did very good job all the time. Wow, look at this composer from Dr. Saida. She passed too, by the way, guys. You know
I
what? Sorry, you know her, right? Sorry?
I remember exactly teaching Dr. Saida composite in the academy. Like the first time she had done it, and then when we did the demo, and her work went like from 0 to like 100. Like you can see that in the composite.
Yes,
Love
guys,
it.
honestly, yes, we're really very proud because this times as you see right now, you think even the amalgam, it's good amalgam, not bad, right?
Yeah.
That's even very good amalgam. Yes, now guys, today what we're going to do is please, guys, if you are in Zoom, I believe it will be a good idea if you can join the Facebook so you can comment there and let us know. Let us know exactly where about your issues because we really need to help you the way. Ah, Dr. Oh, wow. You remember Dr. Rabia? Her
Yes,
work?
yes. Yep.
Look, guys, at Dr. Rabia work. No, I'll show you different things from Dr. Rabia. It was fantastic.
Yeah.
If I can see the game. Ah, yeah, you see her work?
Yep.
Wow. Look, guys, at the composite. I still remember all these candidates. However, now it's about 5 years. Look at the crown. Looks like it's my crown. Looks like it's my composite. That's what always I was told here. So
Yeah.
everyone, guys, will be able to do this good job, definitely. Okay, now she was in 2019, 2020, right? Not Rebia?
That's right.
Yeah, 2021, yes. Okay, guys, please, admin, if possible, just send the link to everyone here. Please, admin, send the link to everyone so they can join and then they can leave their own. By the way, guys, you are very welcome as well to share your work if you wanna really get your work assessed. Guys, what you can see on the Facebook? Guys, please, guys, tell me what you can see on the Facebook. Pin, pin, pin. I don't know why in the Facebook I cannot see what I'm sharing. Let me just adjust this in here. But Alifa, you can see, right?
Yes, Dr. Adam. But I can see it on Zoom. I'm not sure about Facebook.
Yeah. Why can I see it on Facebook then? Oh, now I can see. That's good. Now I can see. Okay, very good then. Okay, guys, let's start. Now, today we're gonna go just to give you good ideas about amalgam. Next time, we're gonna discuss with you more details, more important things. So today gonna be more into tips and tricks. Dr. Alifiya, do you think really it's going to be a good idea to do these sessions in regular basis?
Yes, definitely, Dr. Adam. It's going to be really helpful for
Okay,
all our candidates, like
okay.
exactly like we used to do before.
I think so. I think really that is the way because these days, guys, we feel very proud because last time we had about nine champions passed, and this time about three to four champions passed. If you look at this, it's never happened before. Like ADC before, they never give these big numbers all around. So it means like we're really very motivated to help all of you guys. Now, which amalgam task do you think the... Hi, Dr. Michael, how you going? Guys, which hi, Dr. Lakshmi, how you going? Dr. Vishali, how you going? I'm very happy, guys, to see all of you here today. Now, which task, guys, which amalgam? Is it upper amalgam or lower amalgam? Does bother you the most? Or is it molar? Is it premolar? Which one of these? Let's wait. Dr. Alefia, what do you think is the hardest task? Which task most of the people they cannot pass?
I think upper molar, sometimes students get difficulties, especially because of indirect vision. And premolars mainly, where I see most of the candidates struggle because they don't end up getting a good cusp height, or the entire amalgam just falls off from the cavity while they are actually carving.
Let me a little bit different from you.
Yep.
And then I agree on premolar.
Mm-hmm.
I know most of the candidates, they really find difficulties in molars, which I agree on this. But I believe premolar, right, is actually the things that we have heard lots of complaints out of it, especially if the new candidates, because what happens with premolar is the two structure left, or the left two structure, remaining two structures, they're actually very small, very tiny. So every time the candidate tried to condense the amalgam, it failed. And here, this is one of the biggest issue. The second biggest issue is the contact, especially if tooth number 1, 4. So the contact toward the canine, it can be another issue. Definitely big molars, it can be an issue as well. But I found most of the people really they cannot pass amalgam. That's because of premolars more than molar. And that was before 2020. From 2014 until 2020, mostly was the big molars. These days, or lately, I found people actually feel more in premolars. Definitely, still some other people they feel actually molars too. What do you think about this authority?
Yes, Dr. Adam, definitely. Like premolars, like I was saying, most common where everyone's finding difficulty in it's mainly that the amalgam does not, it's not retaining inside the cavity and it keeps falling, and then they do not end up getting a good contact, exactly like you said with the canine. um, and that's the most common thing which students say that what's happening in the exam as well.
Okay, in this case, guys, look, we're waiting for your questions because we're gonna discuss these two most important points, right? And then after this, we will look for your questions if you have any issue. Right? So right now, I believe this tooth number 1, 5. Am I right, Dr. Alifia?
Sorry, Dr. Adam, what's that?
Can you see the tooth? Tooth number
Yes.
1, 5.
Yeah, yeah. I think
Okay,
that's a 1-4, or I think it's a 1-4 because I can see the canine next to it.
1, 4. Let me check. Is that canine or molar?
I think it's the canine.
Okay, so that's 1, 4 then. Okay, that's 1, 4. So that's the case we're talking about. Now, if we have 1, 4, as you see right now, yes, canine is here. Okay, that perfect 1, 4. I really love it. You see, guys, how nicely contoured all around. And now, the biggest issue coming here from this canine is, or from this side, is actually the contact. Now, let's discuss this very important point, very important trick about how to keep amalgam. Do you think, Dr. Alifiya, the candidates really know these tricks, or actually they know the reason behind this stuff? Because to pass, guys, amalgam, you must understand what is. I always say this to the candidates in academy. To pass the task, you must follow the criteria. Criteria is the most important things. And then one of the things in the criteria, actually, I would say, is the integrity of amalgam. Integrity of amalgam means amalgam shouldn't be broken. So, guys, let's write down this, right? Is integrity of restoration. It means the whole amalgam should be existing and it shouldn't be chipped off, a part of it chipped off. So now, one, how to ensure that amalgam integrity is satisfied. Because I would say this is the most important single criteria about amalgam. How is this? If you go and check the criteria, the rubrics, you will find that amalgam integrity either to be pass or fail. There is no way in between. There is no any criteria that's mentioned. Integrity can be satisfactory or it can be borderline, either very good, like pass, or fail. And by the way, one fail, you're going to fail the whole task. One fail, you will fail the whole task. Now, how to ensure, guys, that is amalgam retained inside the cavity and integrity has been achieved? Any idea? Someone, guys, did the amalgam before I know about it? No, you don't know? Wow. Seems like, By the way, it's not only one factor. If you're going to tell me, for example, button retentive grooves, I say fantastic, that's one out of all. You still have to consider more. Condensation, thank you very much. I love this one. Compaction, good. Condensation, compaction, I consider right as well. Very good. What else? Dr. Alifiya, what do you think about this? And by the way, how to achieve it? The most important thing is how to achieve it. Okay, let's guys tell you about this. One, guys, can you see my writing first? So one, look at this. There's something maybe you never think about it before. You actually want to retain the amalgam in this cavity all around the tooth. So which part of an instrument that you really use it around the tooth to keep the amalgam in? If your answer is the matrix band, it means you perfect. So now you need to understand this in order. One, you must have perfect adaptability of matrix band around the tooth. And thank you very much, Dr. Lakshmi. That was great from you. Thank you, Dr. Vera, as well. That was great from you. Thank you, Dr. Haya. Right? So now, matrix band. Should it be tight or loose? What do you think? The matrix band. Let's put it here number one. Let me just choose different color, which is red color. One, band. Should it be loose or tight? What do you think, Dr. Alifia?
Should it be loose or tight? Your question is about the band adaptation.
Yes.
Well, it can be both ways, Dr. Adam, because if your band is going to be too loose and there is all space around the tooth structure and the band, a lot of your amalgam is going to flow out. That's one.
Yes. Yep.
Second, if you rather keep it too tight, then you won't get a good contour because your band is not touching the adjacent teeth and you won't end up getting a good contact either. So we
Good.
have to have a fine line between. Dr. Adam, is these questions judging my knowledge?
Somehow, Dr. Alifia.
Sorry?
Somehow. Somehow. Somehow.
Somehow. Okay, let's focus on the students, okay?
No, I
No?
like Ray to judge you, to
Okay,
judge your knowledge.
that's good. Yeah, so
Yes.
your question was, I would say either or would be wrong. If you adapt the band too tight, you lose the contact completely because what happens in these situations is, let me draw. Can I draw on this?
I don't think so. Try. If you are in, maybe. Let's see.
Uh, no, I'm not sure.
I don't think we'll be able to do it. No.
Host tools, no. All right. So what happens is if I always tell the students in the demo as well in the academy is how important the band adaptation is because if we have a good band adaptation, we don't have to worry about the contour. That's one criteria. We don't have to worry about the buccal and um, lingual tooth contours, which is another criteria. We don't have to worry about the contact, which is another criteria. We don't have to worry about the contact contour, which is another fourth criteria. We don't have to worry about the cusp height, which is another criteria. And we don't have to worry about retention because that's also another criteria. So out of only that band adaptation gives us a leeway that most of our 6 or 7 criteria are already met if the band adaptation is right. So if you don't take care of the band adaptation from the beginning, then 7 of your criteria are already going towards borderline, right? So if 7 of them are going towards borderline or towards unsatisfactory, obviously you're going to fail if you end up getting still a satisfactory in other criteria. Like if you have like a really, really nice and smooth amalgam, but if you don't have the good cusp height, cusp contour, your contact contour, or your amalgam itself is not retentive inside the cavity, then obviously we're going to fail, right? So there are a lot of criterias which definitely are achieved by only getting the right band adaptation, and that's why it is so important that the band should not be very tight and the band should not be very loose either, right?
Yep. That is exactly Dr. Alifia, what I actually was looking for. So guys, this is, as Dr. Alifia mentioned right now, the band itself, right? It should be tight, but not too tight, and it shouldn't be loose. In this case, every time you do condensation inside the cavity on the amalgam will be trapped nicely inside the cavity. But if it's loose and then you try to do condensation, you will find the amalgam will not stay anywhere. Amalgam will go out, will go between these areas, and finally will not going to go anywhere. So number one, to avoid the integrity, which is the first criteria ever, the most important criteria is integrity. Okay, so let's write down this one. We are talking right now about integrity criteria. Integrity, it must fix it by a proper band. After the band, we are now looking at definitely retentive grooves is good, not bad. So place retentive grooves. How many retentive grooves? As many as you can. 3 to 4 retentive grooves on the floor, sometimes on the wall, but please don't put any retentive grooves into the careful surface margin. Otherwise, it will look like ditches on the amalgam. The third point, you need really to look, you really need to be careful about it, is condensation. When you condense, you use two types of condensers. Dr. Alifiya, I think you are the best to explain about this part.
Yes, Dr. Adam. Uh, Even I would like to add when you said about retention grooves, like retention grooves are great for retention in the first increment of the amalgam, right? Because we mix two capsules and we fill amalgam into two increments, right? So the first increment, yes, when we give retention grooves, it really sticks well. But for the second increment, I always tell the students one trick that the first increment we know it's retained because the floor you're making retention grooves. But when you put the second increment, multiple factors. One factor is that you got to be quick, because if we're quick, then the first increment is not set. So the second increment can actually go and, merge with it. Because once the first increment is set, then the second increment is not going to go sit with it, right? The second reason why the second increment will stay is because of your cavity design. Because we know that our amalgam cavity should be convergent walls. So the higher you go up in the cavity, the walls become more and more convergent, right? So the second increment, that is the top increment, is holding more because of the mechanical retention of the cavity as well, by it being convergent. And that's why you'll face problems mostly in premolars, because in premolars it's not that you have much of space, because in premolars you already have only two cusps, and out of which one cusp is completely missing. So you're not basically getting that mechanical retention from only one cusp, right? Like if you were doing molars, like if you see the picture down for an upper molar here, it has the buccal and palatal walls still intact on one side, and that will be more convergent, which will hold the amalgam properly. And that's why it is so important in premolar to follow the other things which Dr. Adam is saying, because you don't have those features like a very retentive cavity in a premolar, because in a premolar, out of the two cusps, one cusp is completely gone, so you don't have anything for mechanical retention, right? So coming back to my point, the second increment which is there, um the second increment is more with one, that is, you need to be quick. Second, your cavity design. And third, try to fill a little bit more in your second increment rather than filling more in your first increment. All right. Okay, Dr. Adam, you can continue with the third point.
Okay. So guys, again, the third point was condensation. Now, guys, how many points they actually important for integrity? Let's repeat this one again. One, band adaptation. So the band should be tight, not actually very tight, but never to be loose.
And
Two,
Dr. Adam, when it's loose, then when the students are condensing, I see the entire band and everything is moving with it. And that's why the amalgam never stays. Like everything is shaking with the band because it's loose.
I agree in this. And by the way, guys, this is going now to open a very, very, very important point. When you are working amalgam at home, your matrix retainer actually not good quality one. And that's why you struggle to adapt the band nicely. So please, guys, ensure always you get a good quality retainer. Now, the second point, as we mentioned, is retentive grooves. You can play 3-4 retentive grooves about the depth, maybe about 1 millimeter deep inside, and the width is 1 millimeter too. You can do it by round bear. Now, the third point is actually the condensation. When you condense the boxes first, like this area here, or this area, the boxes, in this case, ensure the first increment you just use small condenser. Don't use big condenser. And then once you finish the first layer, right, and the second, and then you need to be quick between the two layers. So now you need to do the second layer, and you can start with a bigger condenser. The small things, it can make big difference to retain the amalgam inside the tooth. Now, Guys, let's now check your understanding. If I'm looking at this tools from this side, can at least give me three issues need to be fixed. Please, Dr. Alifia, keep in your mind as well how many they are, okay?
All right, Dr. Adam.
So we can say this. I will put one. I know so far I have got one, two. From this view, I would say three, but I will just keep question mark next to it because this is really very big magnification. So it does actually make somehow difference. Okay, how many did you get, Dr. Alifia? You know what? Make it four. I found four.
I found 5.
Five? Wow. Dr. Alifia got one more than me.
Because you said 4, I said I got 5.
Oh, that's it, right? But actually, because you're gonna count five anyway.
Yeah, I can count it. I can go more in detail. Yes.
Okay, for me it's five. Four
You
is
tell
enough.
me your 4 and then I'll tell you the 5th one.
Okay, let's see even can they got them or not.
Yes.
I think they should have got them. They shouldn't be hard. Second plane, from this view, it can be contour on gingiva floor. Maybe a little bit overhang. Wow, they are very strict, these people. Dr. Hadir mentioned it should be tight. Okay, the contour, you're right about this, Dr. Hadir. And then Dr. Lakshmi, not perfect marginal seal. Marginal seal. You're right, I agree in this. Second plane, Dr. Veer, contour on gingiva floor. Very strict, these people. Dr. Vijayali, bulky restoration. From this view, you can see it's bulky or not. Wow, very good. Contour polish. Yeah, this is the one which I give question mark here, the polish part, but I don't want to be reverse rect because it's really very big magnification, really very big. Irregular marginal seal. Yes, I agree on this. Overhanging, very tight, very tiny. That's the one. Okay, polish, yes. Dr. Alifia, should I start with mine first?
No, Dr. Adam, I'll start with mine.
Okay, Alifia, that's okay.
The cut's position is wrong, Dr. Adam.
Where about you need the cusp position to
In
be?
the center, because this is the buccal cusp.
Okay, I agree in this. So the bucket cusp normally either to be in center or a little bit. Okay, guys, now we're talking, there is one criteria, by the way. Everything we discuss right now, just only the thing you going to make the ADC examiner going to take it for you to pass or not. We never go on something which is not important. You will find this in cusp position. There is criteria called cusp position, right? So guys, please guys go and check on this. So as cusp position, the cusp tip for this is tooth number 1-4. Tooth number 1-4, it will be mostly in the middle or a little bit shifted toward distal, like here, a little bit like that should be somewhere. And by the way, guys, get a cover and try to carve it. If we say that's a meso side of the tooth, because that's a canine, and this is distal side of the tooth because that's a premolar, right? So Dr. Alifia said the cusp tip should be somewhere here in the center. Am I right, Dr. Alifia?
I think you've gone too much mesial, Dr. Adam, in the
Do you want to
drawing.
where about do you want me to go?
Slightly more to the distal.
Like here?
No, slightly more.
Okay. You see, guys, she is very strict about
That's it.
like here.
Yep.
Okay. Why, guys, why we are very strict on this? Because the criteria mentioned 0.5. Do you know how big is 0.5? Like this. Imagine that's 0.5. You see this green point? 0.5. Yes. So definitely the movement from this cusp is zero point 0.5. That's exactly things that are gonna make you actually pass the task or not. That's why you need to be very careful about this stuff. What else, Dr. Alefia?
The marginal ridges are not rounded.
You mean the occlusal
Yeah,
or here?
they
Or
on the marginal ridge, no, on the sides
like here, the contact area?
of the contact area.
Like this one is pointy and this
Yeah.
one pointy?
Mm.
Okay, what else? So the first criteria was cusp position. The second, you said marginal ridge, not rounded.
Yep.
What else?
Third, we already said, everyone said that there is a gap between the tooth restoration junction on the buccal, but that's more because of the cavity design. There's a problem in the cavity. See, the way they've cut the cavity, they've caused a ditch on the buccal surface. Like they've made a bevel, and a bevel will never hold an amalgam. Only composites can hold in the bevel, not an amalgam.
Yep. So here, guys, I believe it's more like cavity design and also, again, the band adaptation,
Loose. Yeah.
right? If the band was nicely adapted here and tight enough, it will not let this overhang to happen, or actually we call it as the criteria guys called tooth,
Restoration junction.
exactly, restoration junction. And then the criteria mentioned tooth, the restoration junction should not be detectable by probe. So now this is shouldn't be detectable by probe. In this case, what you need to do is how to fix this. To fix it by one, as Dr. Alifiya mentioned, ensure you have a good cavity design. And to do the proper cavity design, don't do bevel. So you can use flat end bare in this case to ensure that you have tight adaptation of the band this area. So every time when you condense down this way, the band shouldn't open and then the amalgam is stuck in between. If this happened for any reason, what you need to do, get the curva, the holding back curva, and then you need to move from this side to this side, resting the curva on the tooth structure. Guys, hope I'm clear about this point. Now, Dr. Alefia, we have discussed two things. One, which is a cusp tip, two, tooth restoration junction, and I believe you mentioned something about the sharp line
And
angle.
the distal marginal ridge is higher than the adjacent tooth. So marginal ridge should be equal to the adjacent tooth according to the criteria. But this is higher than the adjacent tooth.
I would agree on this one too. I totally agree on this one too. So, guys, now apart from this, what else? I still have my own points, but not all of them. I actually like, guys, you really got three of them, still two.
I can see particles of amalgam in the gum.
Thank you very much. You got it. Which is amalgam debris. Guys, amalgam debris here and there. Amalgam debris. And by the way, I have found people only failed this exam because amalgam debris. And we have found people, they pass the exam because they clean the jaw nicely, because amalgam debris, it's very simple thing, right? Guys, only one thing left right now. One only thing left. Can you tell me, please, guys, what is this? You need to be quick, please, guys. We mentioned one, cast position. Two, we mentioned about tooth restoration junction. We mentioned about amalgam debris. We
Marginal,
mentioned about, sorry,
marginal ridge height.
marginal ridge height. What else, guys? Dr. Lakshmi said, not polished. Look, honestly, if you want to be that much tight, let's say this. Smooth of amalgam, I agree. Gingival seat overhang, yes, we mentioned overhang. 7. Overhang, but just mild, like small thing. Do you know what? You didn't get what is in my mind right now. Irregular surface, yes, Dr. Fichel, we mentioned this. Damage to adjacent tooth, wow. Dr. Cortline got something which actually no one of us got it before. I'm scared from you, Dr. Cortline, then. Where about this? Wow, how come she got the damage from the... Okay, you know what? Damage to gingiva. No, that's old one, definitely, guys. You cannot judge this one from this stuff because we work on the same job for forever. Tell you something? I tell you right now. Something called contact.
Contour.
Which one? Contour.
Contour.
Yes, contact contour. Which area, guys, missing the contact contour? These two parts, the impressure. Look, guys, at the impressure, the actual tooth impressure. Guys, which criteria come under contact contour? I believe all of you know it, guys. If you be in academy one day, you actually know it. We always say contact contour has two criteria in them. Two things. Contact this and contact this. Contact something, contact something. No? Okay. As long as you don't tightness is separate. Okay, guys, please, guys, okay. This is from me, from my heart to every one of you guys, okay? This is for every one of you. Please, guys, go and read the criteria again. Please, guys, everyone like Dr. Yomna. Please, everyone like Dr. Yomna comment. That's the one I'm looking for. Contact. So we're looking for, because contact tightness, it's a criteria, it's on. But contact contour, still separate criteria than tightness. Contact contour. And the contact contour has two things in them. Contact height, how high is the contact? And then contact width, how wide is the contact? Right? In this case, I'm just giving you a small example. If you look at the premolar here, you will find this part of the premolar nicely contour. But the amalgam restoration just going that way. That's wrong. It should be contoured nicely, exactly like the premolar, to go this way. So all this part, the amalgam between these two lines, this amalgam here, this part should be removed. Same exactly here. Amalgam actually here goes this way. Look at this. Straight. Right? But if you look at the amalgam here, you will find it's contoured on the other side. It goes from here to there and then contoured. Let me just do it from here. It's nicely contoured. So now we need to have a contour start from here. So this amalgam must be removed. What is the best way to remove this amalgam, guys? Dr. Alifiya uses always amalgam carver, which I believe she actually does very good job using the amalgam carver. But not every candidate, they have the good hand skill. Like Dr. Alifiya, with experience, That's why we give them simple trick. Easy, simple trick. Any idea? Again, if you look at this right now, right? If you look at how many criteria we mentioned right now, imagine holding back cover is Dr. Vera. This is what Dr. Alifiya does. And some people, by the way, use the interproximal cover. But do you know actually what is the good way to use here? The easiest, best way, but definitely need to be above the contact, not below the contact. Now, where about the contact should be? Imagine the contact should be here. If we divide this into 3/3, one here and one here, and then the top third, this one. So the junction should be the contact position, which is a contact height, should be between what and what for premolar? The middle third and occlusal third. Right? Which is exactly, that is the best position to get the contact area, which is at the junction between the occlusal third, that is cervical 1/3. This is the middle 1/3. This is the occlusal 1/3. So where about the contact should be? At the junction between the occlusal 1/3 and the middle 1/3. What is the best ever tool you can use it while amalgam is soft? In this case, is composite finish strip. Composite finish strip. Now, what you need to do is get the composite finish strip and only put it here. We mentioned before the contact should be at that level. We mentioned before the contact should be here at that level. You get the strip only inserted until here and inserted only until here. And then with reverse S technique, with reverse S, contour this one and contour this one more. And now we're going to remove this excess and this excess. And then amalgam will not look like a broad like here. Look amalgam how broad it is. The tooth looks like broad, very wide. Look, from here to there, it's very wide. It should be less than this. Guys, am I clear about this? Am I audibly clear about this? Is it easy things? Is it hard or easy? What do you think, Dr. Alifiya?
Yes, Dr. Adam, this is the easy way to do it.
But you use cover all the time, right?
I do, but the strip method is also really good.
And that's why even, look at this, from this view, even proving what we discussed right now from this view. If you look at it from this view, if you look at it from this view, when you look at this view, guys, forget about the occlusal anatomy, okay? It's not about occlusal anatomy right now in this tooth. In the contact, what guys need to be fixed in here? In the contact, there is something must be fixed. What do you think it is? I will be waiting for you. I will count. With very good, Dr. Leah. That was great from you. I love it. Not everyone can get it. I'm really very proud of you because not everyone can get it. Which criteria this with again? Yes, which is occlusal and pressure. Which criteria? You must look, you must mention about the criteria, because if you don't mention about the criteria, as if you cook pizza and then you don't know which stage actually you couldn't end up with good pizza. Which criteria? Very good, Dr. Leah. Fantastic. Can you please help me in this, Dr. Criteria? Dr. Dr. Leah, can you please help me in this? And tell me for contact contour, how many millimeter do you expect actually to get in this contour? How many millimeter? In the width? Because I believe you're totally right. The width is really too wide. How many millimeter do you think will be enough? Will be good. 1.5. Perfect. Wow. How do you know this stuff? 1.5. Do you know, guys, where about 1.5? It's from here. Let me just do it in the right way. 1.5, it will be somehow from this point to this point. The red is the right criteria. Why does it want to stop? Stop. Why? Alifiya, it doesn't want to stop. I'm trying to stop. It doesn't want to stop. Stop. Can you please stop? Sorry. No. Stop. Anyway, guys, that is a good one, okay? So, guys, the red right now, I would say it's a good, this is good, actually, in pressure. If you say in pressure, I still agree on it, right? And then the same things, if you look from this view, the same things you need to remove, you need to get a proper contact contour by contouring this part. Look at it. The same, what you have done by this composite strip, the composite finish strip, the same strokes, the reverse S you did, it will fix from this view as well. And this will be somehow from here, like this way. Which I would say toward the lingual side, not bad. It's more toward the buccal because you can control it more here. But I like this side very much. Very well. Very well. Okay. Now, guys, exactly, guys, so far. Look, if you want to ask question, I'm very happy, guys, take your question if you want to ask question, because otherwise we're going to move a molar. Let's go smaller. Premolar again, that's still good, not bad. Good, good, good. Okay. Guys, what do you think about this amalgam? Doctor, can I get more explanation about S contour S reverse S? Okay, reverse S. First, you need to understand the benefit of reverse S. The benefit of reverse S. The benefit of reverse S is it's gonna give you good contour without breaking the contact. It will result in very good contour without breaking the contact. How it is? You get the strip and then you put one side here and the other side like here. So now every time you actually contour this area. The force here will be 0 at the contact. So I will show it to you again. Let's say if I want to contour this part, I will adapt the strip here, keep this one passive, and go this way like S, right? So now the force will be only placed here at this part of amalgam, and then this green part will be 0 force, 0 force. So in this case, you get a benefit to contour nicely the contact, but never break the contact area or the tightness. That's how we call it reverse S. Is that clear now to you? And this by the strip. I hope now it's clear. Okay. Can you please, guys, give me at least only three issues in this? Dr. Alifiya, ready?
Yes, Dr. Adam.
No problem at all, Dr. Lakshmi. Guys, give me only, guys, 3 issues, please. For me, 1, 2, and how to fix them. Criteria, only need criteria. Underfilled? Okay, let's write down this. Underfilled. 1. What else? I can tell from this view as well. Not polished, 2. Dr. Mustafa mentioned not polished. Okay, not polished. So, Dr. Noel mentioned underfilled. Dr. Mustafa mentioned not polished. Dr. Leah said cast, wow, Dr. Leah catch really the hard stuff. Cast possession. I'm proud of you, Dr. Leah. Cast possession. Tooth, wow. 5. Tooth restoration junction. Dr. N said anatomy. I agree on this. Dr. N, because her name is Anne, she caught anatomy. Unclear contour occlusal. Under contour, uncontoured occlusal. Yes, I agree on this. Dr. Neil. Margin not seated. Not sealed. Maybe not sealed. You mean this area? Margin adaptation on mesial aspect. You mean here? Wow, that's great, guys. I would say that's really great. But ensure, please, every single thing you have mentioned right now, it's one of the rubric, because I need the exact phrase from the rubrics. The exact phrase from the rubrics. Now, Dr. Alifiya, what do you think? If you give me the most 3 important, please, Dr. Alifiya, issues.
Yes, Dr. Adam. Okay.
We're
So,
gonna write Dr. Alifiya points separately, guys, okay? Yes, tell me now, Dr. Alifiya.
restoration finish, no good.
Finish. Fantastic. What else?
Material handling, which is porosities, I can see porosities. On the
Wow.
distal marginal ridge, I can see on the occlusal.
How come you got this process, Dr. Alifiya? Oh, she's Dr. Alifiya. Sorry, guys. Yes.
Uh, debris, it's fine. I don't see much of amalgam debris. Restoration integrity. Obviously, it's present. It's not fractured or it's not loose. So, definitely it's present. Tooth restoration junction. Absolutely not right because there is, you already circled tooth restoration junctions. I
That's
can't
enough.
see.
We only say 3. We only say 3, okay?
Okay.
Thank you. That is fantastic then. Okay. So now, Guys, you agree on all this stuff. Here is, look, what you mentioned right now, perfectly correct. Anatomy, not the best anatomy, which is okay, right? And then finish, Dr. Alifiya mentioned finish, definitely I agree on this. Polish, sorry, porosities, I agree in this is minor porosities, and tooth excision junction. You mentioned as well that the cusp position or cusp height, well, I agree on this. Now, how to fix this stuff? The question here, how to fix this? The most important thing for me in the beginning, I would say, is this chipped part, which is void. Dr. Alifi, I believe she has explained as voids, right? So this and this is voids for Dr. Alifi. Am I right, Dr. Alifia?
Yes, Dr.
Whatever I circled right now, green, right? Yes. Two, finish. How to, Dr. Alifi, how to end with good finish?
There are a few factors.
Yes,
One,
please.
it all starts from, I always tell the students, firstly, it all starts from the right amalgam, because I see most of the students do not understand which amalgam is the good one. Like for your exam, you have to use the SDI, extended carving time amalgam, and you have to buy it from the right sources, because if you buy it from the wrong source, firstly, your amalgam is not good enough, right? It starts all the way from there. So buying it from a proper genuine source where you know it's original SDI capsules. That's one. Second, the mixing time, right? How many seconds we're going to mix. Dr. Adam, you really want me to go in this because you know I go in too much detail.
Yes, you know what? Maybe we can do next session with more details if you want.
Okay.
Maybe just a brief today and then next session, if they are happy to do it. I'm not quite sure. If we really get proper response and then people really like to do it, we can do it next time.
So I
Guys,
think
please,
we should
guys,
keep it for the
okay.
next time then.
Let me double check this first. Guys, if you really guys would you like to have this session regular basis as the way we used to do it in the past, just let me know. Because you know what? We really feel very good when we see 9 people pass in one batch only. Why the other people struggle then? It shouldn't be that hard, right? So guys, if you really guys want with us to do this session again next week, just please guys let us know. Okay, Dr. Alefa, you can just go with the brief. The things can help them at this stage until next week, and then we can go on every single criteria in details.
Yeah. So I said about firstly the amalgam, then the mix of the amalgam, how many seconds you'll are mixing for. That also makes a big difference. Because we all use different kind of amalgamators, so that can also be a bit tricky. So you'll need to decide the mixing time. That's one. But in the exam, you have a fixed mixing time, which is 8 seconds. Then it all depends on how well you are condensing, because condensation also leads to a good smooth amalgam. If you've not condensed properly, it'll have porosities, it'll chip, and that also leads to roughness. Then is your burnishing, how we burnish, because once we burnish really well, that's how we end up getting a smooth amalgam. And then obviously we need to have a nice sharp cover. We need to know the anatomy so that we follow one particular stroke and one particular anatomy and not multiple grooves, which makes it look really rough. And the last one is, I would say, using some amount of cotton just to make it nice and smooth. Please do not use wet cotton.
Yep. I agree on the wet cotton as well, please, guys. Don't use with wet stuff on amalgam, otherwise will be rust when they assess it. And if amalgam really got rust when they assess it, they don't like it because may end up with what we call it as
Creep
small
and
vessels,
shrinkage.
blisters.
Yeah.
Blisters may happen with amalgam after a few weeks when they assess it. So please, guys, be careful. It will not be showing on the same time. And I have found many people they couldn't pass only for this reason. They use too much water on it before it's set. Just they think by this way they
Working
will
time.
increase. Sorry,
The
the
working
setting
time.
time. Yeah, the working time, setting time. But on the other hand, that's true. Definitely will increase it. But once it's hasn't set, and then you put water in it, that will end up with air bubble, which is blisters after a few weeks. So, and there will be rust. So examiner, once you look at it, you will find it's not nicely finished. And then you may wonder, why did I fail amalgam? Why did I fail amalgam? I did very good amalgam. That could be one of the reasons, by the way. Yes. I want to discuss one more point, which is very important. By the way, guys, we're going from now on, we're going to follow up on you on our OSCE group. So please, guys, ensure you are a member in our OSCE group. If you are not, please, guys, join there. Because exactly as we do for part one, we help part one candidates as what you used to do in the past in OSCE group. This group, guys, by the way, look, just to be aware, where about we going? Yes. In ADC, OSCE, Dr. Adam. Yes, that's the one. Let me just go all the way down. By the way, guys, this is the first ever Facebook group has been done for part two candidates on the new system. What's the name of this? ADC OSCE group, Dr. Adobido, something. I think should be that one. Oh, but in this, okay, guys, that's the one, guys, okay? ADC OSCE. Now, do you know what has happened there? Was actually, there's one of the thing was actually tooth restoration junction. Do you know, guys, why the tooth restoration junction has happened there? Let me just search. Let's say amalgam. Kate again. Wow, I love this amalgam. See how nicely tooth restoration junction, nicely contour. Look, guys, at the contour. The one we mentioned. Look at here, the impressure, open each side, the impressure, the contour, the finish. Perfect. Again, tooth restoration junction. If you tell me exactly what is the scientific term we use it for this tooth restoration junction, I will be very happy. How we call it? Maybe next time we'll discuss with you the cavities, cavity design as well, and how to place this nice retentive grooves. Now, guys, can you please tell me how we call this? It starts with the word step, because it looks like a step. Make it easy for you. It looks like step. How do you name this defect? How do you name this defect? It's not actually a ditch can be okay, but not actually a ditch. Step deformity. Dr. Haya, very smart, Dr. Alifiya.
Mhm.
Because I said the first word is step. Dr. Haya said step deformity.
Mhm.
Underfilled? No. Okay, guys. Please, guys, take this and you can read about it once. It's called, guys, step down. Or sometimes we call it step back. But step down is the most common. What does it mean? The dentist, while doing amalgam restoration, they actually used the amalgam carver from the amalgam restoration, which is soft, toward the tooth structure, which is hard. Now, it's called step down defect in amalgam. The reason behind it is, one, using the amalgam cover from the soft amalgam toward the tooth structure. So every time you go this way, you remove some of the amalgam. Every time you move your cover this way, you remove some of the amalgam. Anyway, guys, I believe that was enough for today. If you really guys want us to do this session, let us know. We're gonna be in the group, right? I was very happy, guys, to have all of you here today. Dr. Alifiya, what do you think?
Yes, Dr. Adam. Really happy to see everyone and help everyone as well, because I know amalgam is very, very difficult, very tricky, and um, but we're very sure that we can help all our students to get through this task. Definitely.
Definitely, we're very happy to help them. Okay, guys, I need to go now because I have part one session. I have a session with part one. Yes, Dr. Leah, we gonna do this, Dr. Leah. Can we have posterior composite and end do sessions to Dr. Definitely, Dr. Leah, we can do this. No problem, Dr. Vyas, we will do this, and Dr. Mustafa as well, we can do it. No problem at all. Thank you very much, guys. Have a great night. See you then, most probably next week on same time, which is Tuesday. Thank you very much, guys. Have a great night, everyone.
Thank you, everybody. Good night.
Thank you, Dr. Alefia. Thank you, everyone. Thanks.
Thank you.
Bye-bye, guys. Bye-bye. Uh, anyway, I was thinking about part one candidate, but I don't think we have any part one candidate because they're already in exam today. So poor people. Actually, no, they are champions, not poor. Okay, guys, thank you very much, guys. See you then next time. Thank you very much. Bye-bye. Bye. Thank you, guys. Bye-bye. Have a great night, guys, everyone. Thank you. Bye-bye.